Welcome back to Andersen Acres. Today we're talking about one of the most exciting and sometimes nerve-wracking experiences in hobby farming. Your goat is pregnant and has gone into labor. This is really, really tricky and can be very stressful for the human. Even if the goat knows exactly what to do, us humans can be pretty stressed out by it. So if you've got pregnant does, you'll want to know exactly what signs to look for, what to expect, and how to help if needed. When it comes to how to help, keep your vet's phone number handy. Because if you've never helped a goat in labor before, you will not know what you're doing. Even if you think you will know what you're doing. If you've never helped, you don't know yet. So keep that vet phone number handy. But let's dive in and talk about what happens when a goat is in labor. So first things first, how do you know your goat is going to go into labor? There are a few key things to watch for towards the end of her pregnancy. Watch for the udder filling up. A few days to even just a few hours before she gives birth, the udder will become noticeably larger as it fills with milk. You want to watch for loosening ligaments. I will refer you back to the video we did last week. I will link to it in the video description where we talked about where the ligaments were and how to find them. But right near the base of the tail, the ligaments do start to soften as the body prepares to give birth. If they feel super squishy or even hard to find, labor's really close. If they're gone completely, baby's coming. You want to watch for restlessness. So your doe might start pawing the ground, lying down, getting back up repeatedly. She might be incredibly vocal, so she'll be making more noise than usual. You want to watch for any discharge. So you want a thick, clear, or slightly white discharge from her vulva. That's a good sign that her labor is about to start. Look also for separating from the herd. Again, we talked about this last week. Some goats like privacy when they're giving birth. So if she's off in a corner or hiding, she might be getting ready. Especially if she's kind of banished everyone else from where she is, she might be getting ready. So, goat labor itself. Goat labor happens in 3 basic stages. We'll go over each one and kind of talk about what you should expect and maybe what you can do to help. So first is early labor. This can take up to 12 hours. The doe will be really restless. She'll stop eating. She might stop eating. Some does eat right up until the time where they have their baby. But a lot of them stop eating. She might show some mild contractions. They won't be super consistent and they won't be super hard. You might notice her nesting. So pawing at the ground, circling a lot, laying down, getting up. You also might notice that she's just really loud. So if she's moving around a lot, really loud, expect that she might be really close. It's a good time to move her into the clean, quiet kidding area if that's what you have set up, if that's where you like your does to have their babies. If you notice these signs, move her right away. Because even if she's 12 or 16 hours away from having those babies, it's a good idea to at least be ready. So get her moved. If she isn't already in there, if you see these signs, it's time to move her. After that, you're going to hit active labor. This can be anywhere from about 30 minutes to 2 hours. So this is kind of quite a range. This is when real contractions begin and you might even see a bubble. That's the amniotic sac. Okay, the bubble is normal. All right, you don't have to pop it, but it's okay if it pops. Okay, just ignore the bubble. It's gonna come out of mama and it may or may not pop. Just ignore it. No one's in distress. That's normal. I know it looks weird if you've never seen it, but that bubble is important. It's just part of the amniotic sac. After that, you're going to see hooves. Now with hooves, they emerge like this, but not exactly even. You're going to have one a little bit behind the other. And that's just because 2 hooves at the same time, is very difficult to exit mama. So if one comes at a time, they can kind of ease their way out. Then you'll see the nose. Okay, that nose should be laying between the feet, and the feet should be one a little bit behind the other. Okay, you absolutely should see that. That's the way a goat should present when it's being born under normal conditions. If everything is progressing well, She'll push the kid out within an hour or so of you seeing those feet. Okay? Start kind of timing it. You just want to know that she is making progress. If she doesn't make any progress for 30 minutes, so she's pushing, she's trying, but nothing's happening, you might need to help. We'll talk about that in a minute. But again, having your vet's phone number at the ready is going to be the most important part here. So, the next part of her giving birth, after she's delivered the baby, she's actually not done. Okay, she might have delivered more than one. She might have delivered twins or triplets or quads. But after the last baby is born, she's still not quite done. Now she has to finish delivering the placenta. This can take up to 12 hours after the last baby is born. Once the kids are out, the placenta will pass. This usually happens within a couple of hours. Don't pull on it, okay? If you see it start to emerge, don't grab it. Leave it alone. It will come out on its own. Don't touch. Just let it come out naturally. If you pull on it, you could actually cause some tearing in her uterus. And you don't want to do that. You don't want her to tear. You don't want to cause any kind of prolapse. Let the placenta come out on its own, okay? While this is happening, and again, it can take up to 12 hours, the doe should start cleaning off her own babies and bonding with them. If she's not interested in cleaning off her babies, put them right in front of her. Pick up babies, put them right in front of her so that she takes an interest and starts to clean them off. It's really important that she start to clean them off. Okay, she needs to start that process and start bonding with them. So get those babies in front of her. We'll talk about what should be in a kidding kit in the next video, but you should definitely have some towels so that you can help dry them off, especially if there's more than two, because especially if it's been cold outside, it can be difficult for mama to get them all cleaned off and dried on her own before cold weather gets them. So especially if it's cold, and especially if she's got more than two babies, definitely you want to dry her off. Dry all the babies off. Help her out. Get them right in front of her so she knows they're hers. Help her with bonding, but kind of try to stay a little hands off. Do what you have to do, but don't interfere other than that. So, let's talk about when and how to help a goat in labor. Most goats do just fine. Most of the time, you're not going to have to step in. But sometimes things do not go exactly as planned. It happens. So, here's when you might need to step in. A couple of things you might need to know. If the doe has been pushing for over 30 minutes with no progress, that's a big deal. You're going to want to wash your hands, and if you have a pair of gloves, get them on. If you don't, just roll with it. But hopefully in your kidding kit is a box of gloves. You should have a box of gloves. I have nitrile gloves. Everyone should have a box of gloves in their kidding kit. But if you're out or somehow forgot to restock them, it's okay. Just do it anyway. Because you're going to have to. You want to lubricate your fingers. Again, that's something else that should be in your kidding kit, some kind of lubricant. And then gently check to see if the kid is positioned correctly. If you've never done this, it's going to be scary. Because you actually have to put your hand inside mama and feel for the baby. It's really scary if you've never done it. But after you've done it a couple of times, you get a little more comfortable. This is one of the reasons why you should have your vet's phone number on standby so that you can get some help. If you have the option, before you breed your own goats for the first time, you definitely should attend a couple of goat births just so that you're a little more comfortable with what might happen. Get someone who's done it before to show you what's up, and that will actually help you a lot. So remember, ideally, the front hooves and the nose should be coming out first. If something feels off when you're checking mama, like there's only one leg or one leg is kind of folded back and under, then you're probably going to need to reposition the kid. I know it's scary. This is why it's a good idea if you're not by yourself the first time. Okay, by yourself the first time is completely nerve-wracking. But reposition the baby, see if mama can deliver the baby from there. That probably is all you'll have to do. However, if the baby gets stuck, you'll need to gently guide it out while the doe is contracting. Okay? Sometimes rotating or pushing a leg forward can help. But basically what you have to do is you want to get those front feet in your hand if you can. And above the hoof, don't grab the little hooves. You want to grab like above the hoof, like by the knee if you can. Don't grab the hooves, okay? I'm not going to tell you what can happen if you just grab the hooves and yank. Don't do that. You want to see if you can grab up near the knee, and then every time mama pushes, apply gentle, steady pressure and pull that baby towards you. When she doesn't push, you stop. Don't let the baby retract into mama. You just want to keep calm, steady pressure and get that baby drawing out every time she pushes. Don't fight mama. You need to work with her. So when she's contracting, you pull the baby towards you. When she's not, you wait. And this can take a little bit. You just wait. As soon as you see baby's nose, if you're helping, get that nose clear so baby can start to breathe while you assist mama in the delivery. If you're struggling and the doe is in distress, you need a vet. Okay? Don't wait. If things are going south, call a vet and then help to the best of your ability while you wait for the vet to get there. Do your best, but the moment things start going south, call vet. Worst case scenario, the vet gets there and it's all done, everyone's fine, and he goes home again and you just pay the call-out fee. No big deal. Best case scenario, he saves the baby's life. Okay? So, or mama's life, depending on how south it goes. So, if you encounter complications, the moment you get jittery, call the vet. They will not mind. I promise. If you have a good relationship with your livestock vet, they will not mind coming out and looking after your goat at the drop of a hat. It's not a big deal. So, what do you do if baby's born and it's not breathing? Going to be honest, it's 50-50 here whether the baby's going to make it no matter what you do. What you want to do is the nose and the mouth, get any fluid out of there. Amniotic sac or any liquid you see, pull it all out. Grab it with your fingers, yank it out. You don't want the nose and the mouth blocked at all. You want to rub the baby vigorously with a towel to stimulate breathing. So really rub those ribs, get some motion going, some gentle pats. Try to get some air moving. The baby might have swallowed some amniotic fluid or something and you want it to choke it out basically. You want that baby to cough all of that out. So gentle taps, lots of rubbing, try to get that baby breathing. If you have to, hold the baby's mouth shut and blow gently into the nose. Just very gentle blows, okay? It's basically mouth-to-mouth resuscitation, but through the nose. You're not going to be able to do it through the mouth. Hold the mouth closed and breathe gently into the nose, okay? So do your best. But if baby comes out of mama not breathing, your chances are 50-50 at the very best, even if you know what you're doing. It's not your fault, okay? If a baby doesn't make it, especially if there's multiples, if you have 3 or 4 babies, sometimes what can happen is those 3 or 4 babies, one of them just isn't big enough, strong enough, one of them just doesn't survive. It's not necessarily your fault, okay? It's all right. It happens. Focus on the remaining ones. But do all you can. Just know that if it doesn't work out, it's not your fault. So, now you got the babies out. Everyone is up on their feet. You think you're done, but you're not. There's a couple things you need to do now. The first thing you need to do is make sure babies are nursing. You need to get them that first milk of mama, that colostrum. That is really important. It's crucial for their immune system. They need that colostrum. Even if you know you're going to have to take a baby or two because she had a lot of babies, even if you know you're going to take a couple of babies, you definitely need to make sure that they at least get that colostrum. So get all the babies on mama, even if you have to rotate, because mama only has 2 teats. If she had 3 or 4 babies, you're going to have to rotate babies. But everyone needs a chance at that colostrum. If they're struggling to latch, help them position their head, open up their mouth, get that teat in their mouth. Help them as much as you can to get them to latch. They should figure it out, but sometimes babies need a little help. They're kind of dumb. They're babies. So they're kind of stupid. You're going to have to give them a little assistance sometimes. The other thing you want to do, that umbilical cord, once mama has the babies cleaned up and everything, there is going to be that umbilical stump. You want to dip it in iodine. This helps prevent infection, and you should always, always do it. You should have iodine in your kidding kit. Again, we'll talk about a kidding kit in next week's video because the video is way too long already. But we will talk about a kidding kit, iodine is one of those necessary things. You want to dip the umbilical stumps in just a little bit of iodine. Just a little plastic cup. Boop. Done. Okay, you just to help prevent infection. You do not want them to get an infection in their umbilical stump. That's not fun. So a little bit of iodine will save their life. Then you want to start keeping an eye on mom. Offer her fresh water, a little molasses for energy. Maybe you have goat electrolytes. Give her some vitamins. Make sure she has access to as much hay as she wants. Break out the goat feed. Give her some sweet. Give her whatever she wants. If she wants cookies, you give her cookies. She just had babies. If you just had a baby, you want cookies too. So whatever she wants, she can have. You're going to want to watch for signs of infection. You're going to want to watch for retained placentas. You're definitely going to want to watch for a prolapse where the uterus comes out of the body. That needs help right away. Okay? I am not comfortable dealing with a prolapsed uterus by myself because you have to apply a lot of pressure and I'm not super strong. So I like having someone who can apply that pressure to get that uterus back inside because it's hard. I hold mama, and usually the vet will do it if I have to be in that position. Hopefully you're not in that position. Prolapses are relatively rare, but it can happen. So watch mama for prolapses, infection, and make sure she passes all of those placenta, all of the placenta. Make sure there's no tears. Make sure it's intact. You want all of the pieces so that she doesn't get an infection. For the next few days, you do want to monitor her temperature. If her temperature starts shooting up into fever range, call the vet. There's an infection present. Okay, you definitely need to make sure that you are on top of that. So watch mama for infection. Make sure babies are eating. Make sure everyone is spry, bright-eyed, bushy-tailed. Generally, everyone is fine. There's rarely a problem. Okay, goats are good at this. But it's good if you're there and can kind of be on top of things and help them if they need it. Mama may need a little assistance, and if mama's really attached to you, she may just want you there for comfort. Okay, that's kind of the way our goats have always been, wanting their people. They just want their people sometimes. It's okay. They need a support person too. And that's about it. Most of the time, goat births do go smoothly, but knowing what to expect can help you to be prepared. If you've ever assisted with a live goat birth, I would absolutely love to hear your stories in the comments below. So definitely post about your experiences, how it's gone for you, if you had any complications, and how many babies you had, how many little kids you have managed to raise over the years, because goat kids are absolutely amazing. We all absolutely adore them. And that's about it for us here today. Happy farming, and we'll see you tomorrow.